Hello everyone, so today we'll be talking about migraine management according to nice clinical knowledge summaries. So first we'll be talking about non-pharmacological management. So you're going to advise them to keep a headache diary to identify the triggers and monitor effectiveness of treatment. So whenever they get a headache, ask them to write it down in their diary. What did they do before the headache? So these are the potential triggers. So commonly reported triggers are reduced sleep, skipping meals, when you have had your period before this, or um, during this period you didn't exercise much. So um, yeah, headache diary to identify triggers, and after that the doctor's gonna give them some painkillers for management. So you wanna see how well these medications actually work on you, because everybody responds differently. Alright. Um, Other than that, after you know the triggers, you're gonna have to try and avoid those triggers. And then sometimes migraine tends to be more common, more frequent. Migraine attacks tend to be more frequent when you're stressed, so relaxation techniques can help. And CBT stands for Cognitive Behavioral Therapy. I'm not sure how this works, but this was listed in nice CKS. So other than that, you can advise lifestyle modifications such as good sleep hygiene, since reduced sleep is one of the common triggers, regular meals, since skipping meals is one of the common triggers, exercise, adequate hydration, and maintaining a healthy weight might help. Right. Now pharmacological management, you have acute treatment and you have prophylaxis. So acute treatment, um, you're going to start with simple analgesia. So simple analgesia means painkillers lah. So you can try ibuprofen or any other NSAID, but the recommended one, the one written on CKS was ibuprofen, 400 milligrams. If it doesn't work, you can try increasing the dose to 600 milligrams. Aspirin 900 milligrams. So aspirin, different doses has different effects. So 75 milligrams is the normal antiplatelet therapy. 300 milligrams is when you have acute coronary syndrome. Before you send to hospital, you give 300 milligrams. And then for analgesia, you take 900 milligrams or 1000 milligrams. It's quite a high dose, but not in people aged under 16 years old because of something called Rice syndrome. And then the most simple analgesia is paracetamol, 1 gram PRN, maximum 4 times a day. Right. Other than simple analgesia, you can also try triptans, either alone or with the paracetamol or the NSAID. NSAID is ibuprofen. So, and the first line triptan is actually Sumatriptan, and unless Sumatriptan doesn't work, then you can try other triptans. So 50 to 100 milligrams is the first choice, but first choice oral Sumatriptan is first choice in adults. However, in the children under 18 years old, nasal Sumatriptan is the first choice. So nasal spray, about 10 milligrams if I'm not mistaken of the dose. And then if because a lot of people with migraine will have associated nausea and vomiting. If they vomit, obviously oral will not work, because you eat it then you vomit out. It's not gonna work. So in these people, consider intranasal Sumatriptan or subcutaneous Sumatriptan. And also it says that consider antiemetics, because some studies have shown that it's not a very high quality study, but some studies have shown that paracetamol and metoclopramide given together without the triptan actually works better than triptan alone. So there's some study that says antiemetics works. One of the theories is that because in migraine you have gastroparesis, so metoclopramide actually promotes the gastric peristalsis, if I'm not mistaken. And then because of the gastroparesis, if you take the paracetamol, it won't be absorbed in your gastrointestinal tract since it's stuck up there somewhere. But if you add metoclopramide, it will help to push the medication in so you can absorb it better. And also the other antiemetic is prochlorperazine. And how you advise them to take the acute treatment? You should take early while the pain is mild. So not when you don't wait until the pain gets worse, because at first migraine usually at first is not so painful, and then it gets more and more painful as time goes on. So take it early while the pain is mild. If people with some people have migraine with aura, so before the migraine they get some symptoms such as visual symptoms or auditory symptoms, they hear something or they see something. Don't take the triptans at the don't don't take the triptans at the start of the aura. Take them at the start of the headache. Yeah. So only after the aura, at the start of the headache, then you take triptans. Right. And then prophylaxis, there are three. These two are first line. So propranolol and topiramate are first line. But prophylaxis is you only give to people who have very frequent migraine attacks, and you discuss with them before giving, because it's up to them. If the migraine they find very debilitating and it's coming on quite frequently, at least once a week or something, then they might want to take this prophylaxis, but don't offer them to children and pregnant women, at least in primary care. Pregnant women, definitely not, because some of these drugs are teratogenic, especially topiramate. It can cause your baby to be abnormal. Propranolol can cause intrauterine growth restriction. So only adults. Prophylaxis, the choices are propranolol 80 to 160 milligrams daily in divided doses, or topiramate. So you got migraine, you want to prevent migraine, you pakai topiramate, okay? Topiramate 50 to 100 milligrams daily in different doses, in divided doses. Contraindicated in pregnancy, highly effective contraception is required prior to initiation. And one thing about contraception is topiramate actually disturbs your contraception as well. So it makes the OCP, COCP, combined oral contraceptive pill, less effective. So you want to use other methods of contraception that doesn't involve hormones probably. Or other than these two are first line, you can also try amitriptyline, which is actually a treatment for neuropathic pain, 25 to 75 milligrams at night. Yeah, I think that's all I have for you. Hope it helps.